The COVID-19 pandemic has profoundly impacted individuals and communities worldwide, serving as a significant example of collective trauma. Collective trauma refers to events that affect large groups of people, leading to widespread emotional, psychological, and social consequences. This video analyzes the impact of collective trauma events, like the COVID-19 pandemic, and discusses strategies for societal healing and resilience. Understanding collective trauma. Definition and characteristics. Collective trauma occurs when a traumatic event impacts a large group of people, leading to shared emotional and psychological responses. Unlike individual trauma, collective trauma affects communities, societies, or entire nations. It often results in a collective sense of loss, fear, and uncertainty. Collective trauma can disrupt social norms, challenge collective identities, and create a pervasive sense of vulnerability. Examples of collective trauma. Historical examples of collective trauma include natural disasters, wars, terrorist attacks, and pandemics. The COVID-19 pandemic is a recent example, causing widespread fear, grief, and disruption. The shared experience of loss, whether of loved ones, jobs, or a sense of normalcy, has left lasting scars on societies. Other examples include the 9/11 terrorist attacks, the aftermath of Hurricane Katrina, and global conflicts. Impact of collective trauma. Emotional and psychological effects. Collective trauma can lead to a range of emotional and psychological effects, including anxiety, depression, grief, and post-traumatic stress. The pervasive uncertainty and fear associated with collective trauma can exacerbate mental health issues and lead to a sense of helplessness and despair. The prolonged nature of such events can also contribute to chronic stress and burnout. Social and economic consequences. Collective trauma events can disrupt social structures and economic systems. The COVID-19 pandemic, for instance, led to widespread job losses, economic instability, and disruptions in education and healthcare. These consequences can strain community resources and increase social inequalities. The economic impact of collective trauma can result in long-term financial instability and hinder recovery efforts. Impact on community cohesion. Collective trauma can both weaken and strengthen community cohesion. On one hand, it can lead to increased social isolation and mistrust. On the other hand, it can foster solidarity and mutual support as communities come together to cope with the shared experience. Acts of collective mourning, community initiatives, and mutual aid efforts can strengthen social bonds and promote resilience. Strategies for societal healing and resilience. Promoting mental health support. Access to mental health services is crucial for addressing the emotional and psychological effects of collective trauma. Providing resources such as counseling, support groups, and crisis hotlines can help individuals and communities process their experiences and begin to heal. Integrating mental health support into public health initiatives can ensure comprehensive care for affected populations. Fostering community resilience. Community resilience involves the ability to adapt and recover from adversity. Building community resilience requires strengthening social networks, promoting mutual support, and fostering a sense of belonging. Community programs that encourage collaboration and support can enhance resilience. Initiatives such as community centers, support groups, and local events can provide opportunities for connection and healing. Addressing social inequities. Collective trauma events often exacerbate existing social inequalities. Addressing these inequities is essential for promoting societal recovery. This includes ensuring equitable access to healthcare, education, and economic opportunities. Policies that prioritize the needs of marginalized and vulnerable populations can help reduce disparities. Social justice initiatives and advocacy efforts can promote equity and inclusion. Commemorating and remembering. Commemorating and remembering collective trauma events can play a vital role in healing. Memorials, ceremonies, and public acknowledgments can provide a sense of closure and honor the experiences of those affected. These acts of remembrance can foster collective healing and resilience. Creating spaces for reflection, dialogue, and education can ensure that the lessons of collective trauma are remembered and learned. Strengthening public health infrastructure. Investing in public health infrastructure is crucial for preventing and mitigating the impact of future collective trauma events. Strengthening healthcare systems, improving emergency response capabilities, and promoting public health education can enhance societal resilience. Ensuring that public health policies are inclusive, responsive, and adaptable can better prepare communities for future crises. Case studies of collective trauma events, such as the COVID-19 pandemic and the aftermath of natural disasters, provide insights into the strategies that have been effective in promoting recovery. For example, the community response to Hurricane Katrina highlighted the importance of grassroots initiatives and local leadership in disaster recovery. The global response to the COVID-19 pandemic has underscored the need for international cooperation and coordinated public health efforts. The COVID-19 pandemic has highlighted the profound impact of collective trauma on societies. Understanding the emotional, psychological, and social effects of collective trauma is essential for promoting societal healing and resilience. By implementing strategies such as promoting mental health support, fostering community resilience, addressing social inequities, commemorating and remembering, and strengthening public health infrastructure, we can support communities in recovering from collective trauma and building a more resilient future. Recognizing and addressing the unique challenges of collective trauma can help create stronger, more connected, and more resilient societies.